Keeping a herd of 700 dairy cows healthy and happy takes good nutrition and regular checkups. I got a chance to tag along with a large animal vet who showed me what it takes to keep the herd humming along. It's time to haul away some milk. Here at Arbaugh's Flowing Springs, farmer Steve Arbaugh has 700 cows on his 360-acre dairy farm. Steve milks the herd twice a day, and when he ships it out, it ends up in grocery stores throughout the Washington, D.C. metropolitan area.
Our goal here is to produce a product that consumers appreciate, good quality.
Of course, you can't have high-quality milk without a happy, healthy cow. That's why every Tuesday morning, veterinarian Locher Bray and his son Tyler pay a visit to Steve's herd for a routine physical examination.
They've been coming out since the early 1980s and doing work for us, and they do a very good job. They're in depth with all the herd checks that they do.
That means using equipment similar to what you'd find in a hospital.
So I can see the image through these goggles here.
Today, the dairy docs are using an ultrasound machine, and it looks like they've got good news for Steve.
And this cow is pregnant. I can see the calf sitting there. It's kind of like it's on its back right now. It's kind of how you're looking. Those are legs that are sticking up in
there you go.
In the air, and that's the head right there. See that? You can kind of see the shape. The nose is pointing that way. That's its skull, kind of curled around, tucked back towards its feet.
Veterinarians could just use the old-fashioned method, a rectal exam, to determine if a cow is pregnant. But by using ultrasound, they can get more accurate information faster. Right now, this cow is only 57 days along, and the fetus is the size of a mouse and growing fast.
As a dairy farm, one of the more important things to do is to get these cows pregnant so that they have a calf, hopefully maybe once every 12 or 13 months, which will keep these cows in peak milk production.
A healthy cow means more milk, so understanding their nutritional requirements is important.
This is alfalfa haylage, and that's a fairly stemmy plant, and you can tell a little bit about whether it was made at the right maturity or not just by the feel of the stems, you know, how rigid they are, how soft they are.
Feed nutritionist Bill Weiler is gathering feed samples to take back to his lab to determine the quality. He says periodically testing the feed for protein, fiber, sugar, and mineral levels is essential.
We have to know the individual components of each one of those feedstuffs in order to put that into software and make a good nutritional program for his cows.
A good batch of hay will keep the doctor away, most of the time.
Cows normally don't have any issues. When they have calves during that transition period is usually the time when you will see problems.
This cow gave birth just 20 days ago. Since then, she hasn't been eating much, but Dr. Bray knows her well enough to diagnose the problem. A urine test shows her sugar levels are low.
A little bit of ketosis. Ketones come from the breakdown of fat, so when these cows come fresh and they're not eating enough, they start breaking down their body fat to keep up with their milk production. They get what's called ketosis. Those ketones actually make them feel bad, so then they don't eat, so we're getting ready to treat her for ketosis.
By listening in on the cow's stomach, Dr. Bray can diagnose if the food is being digested properly.
I can tell you she's a little bit depressed in the rumination department. You saw me listen to her rumen, which is her cow's first stomach, and those things roll 2 to 3 times a minute when a cow's feeling well. Then you'll see them chewing their cud. Hers is a little bit off, maybe 1 a minute, something like that.
Because she hasn't been eating, her glucose levels are low. Looks like it's time for a boost of energy. So what's going to be the treatment for her?
We're just going to give her some dextrose IV in the vein, which will increase her energy level, make her quit breaking down her own body fat, which will decrease those ketones.
An increase in energy means a cow with a healthy appetite.
Okay, so we're done treating her. So hopefully she'll be back on her feed and, you know, giving Steve a lot of milk here in a day or two.
The rest of Steve's herd lines up for their afternoon milking, while others enjoy their nutritious feed, staying healthy to impress Dr. Bray during his next visit.
Tyler, I'm gonna have you walk.
Dr. Bray calls on patients at about 120 different dairy farms throughout Frederick, Howard, Carroll, and Baltimore counties. And when it comes to milk production, Frederick County leads the way. It's home to about 1/3 of Maryland's dairy cows.
Stream anytime, anywhere with the free PBS app.